And joining me today is Ariel Schönfeld, the medical director of the Schmieder Clinics. Professor Schönfeld, thank you very much for being with me.
Pleasure for being with you.
Schmieder Clinics specialize in early rehabilitation. Can you tell us a bit more about that field of specialty and others that you might have?
Yeah, actually, it's not just early rehabilitation, it's the entire field of neurological rehabilitation. So we're specialized in neurology with a strong focus on rehabilitation. Early rehabilitation, these are patients who are kind of heavily impacted by the disease, by a neurological condition. Mostly they come directly from an ICU. Many patients are ventilated. Some of the patients have even not consciousness levels that we can talk to. We have in Germany a big need for this type of rehabilitation, and this is what it is all about.
So that might apply after a stroke, but it also applies, of course, after a COVID infection, I gather. Can you tell me about the learnings that you've had during that pandemic?
Yeah, actually, so strokes and bleedings, these were like the patients that we always have had and that we're still having. With COVID, what came again are the patients, of course, who are spending a longer time in an ICU. So they come with a myopathy or neuropathy, which we call a critical illness neuropathy. So these patients are kind of known. So everybody who spends a lot of time on an ICU has the problem to develop that because of not moving and so on. And this is also true for the COVID patients. And what we also realized afterwards, because these patients recover quite well when they are with us, we noticed that they have also these cognitive problems. And this is actually one of the main problems that we will have also for the future. We need to take care also of these problems. And there are many more patients with long COVID than we are believing right now. And this is actually, I think, the task for the next years to treat these patients and also to find them.
So cognitive problems, long COVID, is that something where you see Schmieder Clinics as a special place to go to, basically?
Well, we are, as a neurological rehabilitation hospital, we are, of course, a place where we kind of treat patients with cognitive problems. So this is what we do since many years, since we exist. And what we have done is to really closely look at these patients with COVID and who had COVID, and we developed a special program that would kind of be a special patient-tailored mixture of therapies that would fit to the individual case. This is what we also do for the other patients, but in COVID we have also components that we didn't have in other neurological conditions like breathing therapy and these things.
Okay, thank you very much. Interesting to learn about that. Thank you very much for your time.
Thank you.
Thank you for listening. That was the Schmieder Clinics. Thank you.